also live on our TikTok account and also Facebook. So head over there to see who do we have in the studios right now and what I'm wearing. But anyway, yeah, we have Nirmala Jagan. She's a pharmacist, UF 114, all right, Cardiology Center from Sultan Idris Shah Hospital, Serdang. Thank you so much for coming to the studio, Ms. Nirmala.
Thank you so much.
It's been such a pleasure. I mean, just talking to you off air, you've been in this particular health industry for like 20 years already.
Yes, you're right.
And you're the intermediary between the doctors and also the patients. You
I would say that.
prescribe them all kinds of medications required for them. And if there's any inadequacy in terms of medication, you'll definitely inform the doctor and also the patient as well on what they should and should not take as well. You are like the medical guru in a way.
I will say the doctors would prescribe, and we are the medication experts who will deliver these medications to the patient, ensuring they receive the right medication and they take it as prescribed, as intended.
That's great. Okay, so if you have any questions for our guest here today in the studio, you can either head over to our platforms, social media platforms at TRAXXfm OFFICIAL, or just give me a call at 0322824746 or 5491 and ask the good guest on today's topic, which is Stronger Heart, Smarter Care. So without further ado, could you give us a little opinion on your idea of heart failure and what happens to the body?
All right. Thank you so much for the question, DJ Otto. So heart failure, what it means is that the heart is unable to pump efficiently as it should to ensure there's adequate blood supply throughout the whole body, including our vital organs like our brain, including the heart, our lungs, kidneys, and so on. All right. Although the term heart failure includes the word failure, it doesn't mean that the heart has failed completely. It is just that it's unable to function efficiently. All right. So what happens to the body is that when since we know blood carries all the oxygen, so when the heart is unable to pump efficiently, so therefore the blood won't be able to reach all our vital organs as required. So the oxygen demand may not be met, and this can be detrimental.
To put it simply.
Yes, to put it simply.
Not enough oxygen going into the body. Exactly. So there we go. A simple example for you to actually understand what is heart failure. Now, what are the signs?
What are the signs? All right, signs and symptoms. Okay, when you talk about symptoms, this patient, because the heart is unable to pump efficiently, therefore there will be fluid imbalance in the body.
Oh, what does that mean?
Okay, fluid. That means the water can actually be retained in the body a little bit longer. So it can, if at all, it is accumulated more than that the body could contain. All right. So what happens? This water will end up in the lungs, resulting in difficulty in breathing.
And we're not talking about fat, right? Water retention is nothing to do with fat.
Nothing to do. It's just water.
It's just water.
So, and if it ended up accumulated at our lower limbs, our leg, so our leg will become swollen, cold and clammy. So whenever the doctor does a little test where they put a little finger to press it in, they will have what we call the pitting edema, where they can see a little like a pressed, you can see like a pressed nature on the leg.
And it's hard to actually go back to
it. Wouldn't bounce back easily.
Yeah.
All right. So that are the two common presentations. Second will be extreme fatigue, because remember there's no enough oxygen to all the vital organs. All right. And they may even experience dizziness or even palpitation. All right. The heart beats a bit too fast.
Oh my goodness. Okay.
Yeah.
So we have two different signs over here: fluid imbalance.
Yes.
And also fatigue.
Fatigue.
Okay. So those are the two signs.
Yes.
Now, what about the risk factor on this?
Risk factors you can divide into two types: modifiable and non-modifiable. So the non-modifiable will be things like your age, gender, family history, which you can't do anything about. Okay, but the modifiable ones are like hypertension or high blood pressure, diabetes, smoking, alcohol consumption, or even a sedentary lifestyle where we can take charge and do something about it. All right. So these are the modifiable risk factors that we should look into.
Now, I'm interested to know, because when you're talking about signs, right, fluid imbalances, how does even one know that it's starting to happen in your body?
Okay, it's a very good question. So these patients, whenever they are diagnosed with heart failure, the doctor would already give them what we call how much of water can they drink in a day.
Oh.
Okay, there's a water limit. Sometimes some can only take about 500 ml, a small mineral water bottle. Some maybe two, about 1 liter.
Wow.
Okay, so it ranges from 500 ml to 1 liter. All right. So when there is a limit, the moment the patient drinks more than what he or she should, that's where the water starts to accumulate. And this accumulation, they will feel it the moment they feel, there's a little bit of shortness of breath. Like I say, the water enters into the lung. When there's too much, they won't be able to breathe well. They will end up coming to the emergency.
Now, when it comes to you mentioned about fluid imbalances when you press on, let's say, your feet, it
Yes.
doesn't bounce back immediately.
Yeah.
Now, as other side of the body, does it always accumulate in the foot or on the arms or any part of the other body?
It's a very good question again. It generally happens at the lower limb, which is your leg. Why? Because of the gravity most of the time.
I
As
see.
for our hands, we tend to use it and move more often. All right. So that is why it's unlikely to happen on our arms.
Or even love handles.
Yes, our love
I
handle.
see. All right. So if you have any questions for our good guest here today, we're talking to Nirmala Jagan, a pharmacist from Cardiology Center, Sultan Idris Shah Hospital, Serdang, talking about stronger heart, smarter care. If you have any questions, let us know through the comment section on our TikTok account or even Facebook at TRAXXfm OFFICIAL. Don't forget to like it and share it with your friends or family member or anybody close to you right now, because this might be a very important factor that you need to know when it comes to your health. I'd just like to say a quick hello to Christiana Chin. It says, hello, good morning, Otto and Nirmala Jagan. Pamela Fong says good morning as well. Thank you for joining the live as well. For those on TikTok as well, if you are interested to know further with regards to what medication to take, or probably you have any issues happening right now and you'd like to know about what is heart failure, this is the show for you, and please share it with your friends. Now, before we let you go for a brief moment for a break, we'd like to ask you, what are the treatments available for someone who have heart failure, and can it be completely cured?
Okay, so to answer the first question, what are the treatment available? There are treatment available. In fact, over the years, we are identified there are 4 pillars, we call them, which I'm going to explain in a while later as we talk about the types of medication. So when the patient is able to take all these 4 pillars, 4 types of medication, what is our major aim is that we want to reduce or make sure their symptoms are more controlled, okay, so reduce the symptoms and improve their quality of life. When we talk about cure, it's rather unfortunate. What we can do is to contain the symptoms, but we do not have the technology to cure it immediately, okay, or to cure it over the time. So this medication, they are meant for lifelong, all right, unless over the years there are some miracle treatment. But these patients should be taking this medication as prescribed by the doctor lifelong, unless told otherwise.
Looking at some data which we have also, SOXO, according to a report, there's 2.3 million people suffering from diabetes, which is also one of the factors that could cause heart failure as well. The things that probably could that we could do at home, like you talked about symptoms. What are the symptoms that we can actually identify?
Symptoms, as I mentioned earlier, so if you have diabetes, of course you need to control your diabetes. If you notice that your diabetes are not being controlled with the existing medication that are being prescribed, reach out, go to the clinical kesihatan health clinics, or you meet your doctor, the prescribers. Tell them about the current condition. If the medication is not suitable, the doctor will be able to help. The pharmacist will be able to advise if there are any, symptom management that can be done. Okay, but the doctors will be there to prescribe you or, give you probably another option, another alternative. And with that, make sure you control your diabetes well. If this diabetes is not controlled over the years, one of the major complications that we know from diabetes is cardiovascular disease. So from this cardiovascular disease, if you end up having a heart attack, for example, and this heart attack, if it's again not managed well, when you don't take your medications as prescribed, it can lead to heart failure over the years.
Now, it's also a very secretive kind of, this is a disease, right? Heart failure.
Heart failure,
yes. You wouldn't know it until it happens to you. So, yeah, make sure that you take care of your health. And how long or how often should we have our health screening?
Okay, when we talk about health screening, it should be done annually, especially now you know that at age 35 to 40, we are seeing more and more younger Malaysians are coming with diabetes, hypertension, dyslipidemia, or high cholesterol level. All right, so these three medical condition, it has to be monitored. The moment you know there's any derangement, seek or consult your doctor. All right, get the proper treatment and take your medication as prescribed. This is most important. So when you take these medications, if you experience any side effect, do not stop on your own. All right, tell your pharmacist, tell your doctor. So from there, there's always alternatives that they can always give you.
And you cannot lie to a pharmacist, right? They know if you're taking your medication or not. Right? Okay, so we're talking to Nirmala Jagan, pharmacist UF14 from Cardiology Center, Sultan Idris Shah Hospital, Serdang. We're talking about stronger heart, smarter care. So once again, if you have any questions for our guest here today, you can either hop on to our social media accounts, like on Facebook, we are live there, and also on TikTok. Just leave a comment down over there, and then I'll read it out. Or else just give us a call at 03-2282-5491 or 03-2282-4746. Just a quick hello to Maisie Jenny says good morning, and also Abdul Malik Rahman. Good morning to you guys as well. Hope you're having a wonderful Monday. So we're going to go back. We're going to go for a little short break, and when we come back, we're going to talk about further with regards to our heart failure and all that good stuff. So stick around right here on Traxx. 31 minutes past 11. Good morning, Malaysia. This is Traxx Midday Buzz, and we're talking about health on Traxx. Topic of the day is Stronger Heart, Smarter Care. And in the studio right now, we have Nirmala Jagan. She's a pharmacist from the Cardiology Center, Sultan Idris Shah Hospital in Serdang. Once again, thank you very much for coming to the studio.
Most
Ma'am.
welcome.
Now, with regards to, heart failure, we already discussed about what are the symptoms, the risk factors, and also treatments. Now we're going to talk about more about the medication that's into play and also the challenges that we face, so all that. But anyway, if you have, once again, any question for our guest here today, make sure you head over to our social media account because we are live on Facebook and TikTok. And the handle is TRAXXfm. Now, either way, if you're listening us through the radio and you feel like you want to call us, well, the numbers are 0322825491 or 0322824746. Now, we have a question on Facebook already, but we're going to get into that in just a bit. But anyway, Ma'am Nirmala, what about the medication? What types of medications are commonly used to treat heart failure, and how do they actually help?
All right. Thank you so much for this question. So there are 4 pillars that we say. Okay, they are known as the guideline-directed medical therapy. So these 4 medication, they are consist of the first one. We call them RASI. Okay, RAS inhibitors. They can be either angiotensin converting enzyme or ACE inhibitors. I'll give you an example as I mentioned these groups, such as perindopril, which are more commonly prescribed, angiotensin 2 receptor blockers or ARBs, such as your valsartan, angiotensin receptor neprilysin inhibitors, ARNI we call them, or Entresto. Okay, they are combination of valsartan and sacubitril. Okay, so this combination or the group, like I said, the RASI inhibitors, how do they work is that they widen up the blood vessels. So as they widen up the blood vessels, they lower the blood pressure. Okay, so this way they reduce the heart's workload.
Wow.
All right, so that's the first of the 4.
Okay.
The second one will be the beta blockers. The more common one are bisoprolol. They slow the heart rate to help the heart pump more effectively. Okay. The third one is you can actually call it either aldosterone antagonist or mineralocorticoid receptor antagonist. Okay. What does this medication do is that they block a hormone called aldosterone. Okay. By doing so, they regulate the fluid imbalance. Okay, so when they regulate, they avoid the fluid buildup in our body.
So you're saying that it's because of hormones that the imbalance is happening?
Yes, it due to the fact that the moment the heart is unable to pump effectively, there is signal that are sent, to our brain and to other parts of our body where they actually signals, why isn't the heart pumping enough blood? So could it be because of lack of volume? Is it, there's no enough fluid in the blood? So that is where, when the signals are sent, the body will automatically respond by accumulating more fluid. So by accumulating more fluid, what the body thinks is that, okay, now I can send in more blood throughout the body. All right. So that is why we have to use this medication to avoid the excess fluid buildup. All right. The last of the 4 will be SGLT2 inhibitors. What they do, okay, this medication, of course, they were originally developed for diabetes management. Okay, some non-diabetic patients, patients with no diabetics but heart failure, they will receive these medications as well. It is not for diabetes per se, but these medications are known. Okay, studies have shown that they help in the management of heart failure. How? They help the kidneys to get rid of excess water, okay, by removing the sugar and the sodium, a type of salt, sodium in the urine. Therefore, they reduce the fluid buildup in the body. Okay, so all these medication, when they are taken together, unless the doctor, when they find out maybe the blood pressure is too low, the heart rate is too low, maybe the kidney, the function is a bit, impaired. So if they find there is reason not to give, of course they won't give all. But if all the factors are right and the patient is able to receive all, if they are on all these 4 medications, that means they are on all the gold standard medications.
Wow.
All right.
Is there any issues if you take all 4?
No, none. They should be on all 4 unless contraindicated, like I said.
I see.
Okay, and on top of all these 4, there's another medication that they would be on, which is known as the furosemide or the water pill. All right. So these medications, when they take, they help with the symptom relief. Too much of water intake can be addressed using this furosemide. Some patients, they are even educated, they are told to adjust. If they know that particular day they have more water intake, they may actually take half a pill or one pill, depending. So this medication is known as furosemide.
Now, what's the longest medication prescribed so far when they take all these four medications?
As I mentioned earlier, for the first four, it'll be for lifelong, unless in between there's any, kidney damage or low blood pressure or low heart rate. So, and with advancement, things may change. What we know last 5 years and what we know now, things have evolved so much.
Wow. Now, can I ask, what are the challenges faced by patients in heart failure treatment, and how actually can pharmacists actually help?
Okay. So when we talk about patients, even when I mentioned there are 4 types of medication, right? This is like the minimum 4. Okay. Sometimes they may even have underlying diabetes. They may have, cholesterol. Okay. So when they have, some of them may even end up having 12 to 15 types of medication.
Wow, that's why having a health screening is very important.
Very true.
Okay.
So these patients, when they have a lot of medications, sometimes they don't even know which to take first. Okay, so that's where a pharmacist can come in, telling them, okay, this one you should take before food, this one you should take in the morning, this one you should take in the evening, So we are there to tell them what should be taken when. Okay, and the second thing is that some medications may exert side effects. Okay, some side effects can be self-managed. Okay, so the pharmacist is there to tell them. But some side effects require medical attention, and that should be brought forward, should be informed. So when they experience this, they shouldn't stop on their own, the medications. And, when they come to the doctor, if they don't tell, the doctor or the pharmacist is just going to think they're taking this medication. All right, so it won't be helpful for both parties.
So please disclose any symptoms that when you're taking a medication, any symptoms that might be, happening in you. You must actually inform your doctor. Yeah. Okay.
Okay. So if they have got issues with forgetting, like I said, they've already got 10 to 12 types of medication, for example. So they may forget, they may, feel demotivated. So that's where the pharmacist can step in, even in fact the family support. Where you get a pill organizer telling them when to take or set a reminder in the phone so that they will remember to take. So these simple gestures can actually help the patients more.
And also lifestyle as well.
Exactly.
So can lifestyle changes actually help control and reduce impact of heart failure?
I think, in this current era, with regards to most of the medical conditions, especially like non-communicable disease like hypertension, diabetes, or even heart failure, all right, lifestyle has to go concurrently with medication, all right? And I've got a acronym for this, SMILE, okay, S, sleep adequately, and stress management, okay, that's for S. M, medicate. If you're already on medication or you're on some form of supplement, you should medicate and meditate. Meditate doesn't...
I was just about to say that. Meditate, okay.
Okay, you read my mind then. So meditate doesn't have to be where you have to sit in a lotus position. You can, as long as you have some, quiet time, that is meditation as well. Everybody has their own way of doing things. And I, interact. I think in the era where we are all, consumed with our digital technology and so on, we need to start interacting with our loved ones, nature. Okay, that's interact. I, L, love yourself and learn something new. Okay, it's important that we do that. E, finally, eat well and exercise. So if you smile, your heart will smile back at you.
There we go. So summarize is smile. Okay, it's you must smile. Also be what's another word for it right from aside from smile that you mentioned earlier on?
Smile.
Yeah, smile. Just smile. Okay.
Yeah, so that the heart smiles at you.
There we go. Meditate also or mediate as well, right? And then also interact and lifestyle, love yourself, and finally eat healthily and also exercise well as well. Yeah. Now we're going to our little question over here from Facebook. Jesh Sharma says, hello and a very good morning. I had 4 strokes already and stones in my gallbladder plus fatty liver recently. I have noticed that I am always tired and forgetful. At times for days I forget to take my meds. At times I'm super hungry and also times I don't eat at all for days. How bad is it?
All right. Thank you so much, Mr. Jesh, Miss or Mrs.
Jesh Sharma, yeah.
Jesh Sharma, yeah. Okay, this question, I believe, sir, it's about time you seek medical attention. You need to see your doctor, tell him or her all about this so that they can advise you further, because having 4 stroke is no joke.
Yeah.
All right, so there must be some form of blood thinner medication that are being used. So over this, platform, this is not the best method for us to answer. Okay, because we need to know what is really going on. Why are you experiencing this sudden hunger or all the symptoms that you experience now? Okay, maybe there's something impending, and before we, some complications occur, it's best for you to see your prescriber and tell them what is going on. Okay, why the medications, are they helpful or not? They'll be able to do the assessment.
So there you go. I hope that answers your question, Jess Sharma. We cannot actually identify because you have, of course, medical records with your doctors and nurses and also pharmacists. So go seek help from that area expertise, and hopefully you'll get over your situation very quickly, Jess. Thank you so much for that question. Now, what are the common myths? I would like to know. What are the common myths or misconceptions about heart failure?
All right. Okay, talking about misconception, most of us, okay, we think that heart failure is a disease of elderly, right? The older generation. Okay, that's a myth. Why? Because we do see younger generation, okay, as young as 25 years old coming in with heart failure. Why? Again, because of lifestyle, because of the underlying disease such as hypertension, long-standing hypertension, 20 years of hypertension. So they even started young, like 20 years old, 15 sometimes, they've already having long-standing hypertension. And by the time they come in at 40, they've already got their heart failure, okay? And some think that heart failure is a short-term disease, where, it's just like your fever, you take, a 1 week course of antibiotic, poof, it's gone. Okay, it is not like that. All right. And last but not least, some of these patients, they think the moment I have heart failure, I can't do anything because my heart failed. Like I said, the term, it can be intimidating, saying it's heart failure. All right. But it is not such, whereby it doesn't mean you can't do anything. In fact, I've got some interesting, a story to share, whereby I've got a gentleman in his 50s. I tell you, he told me that he walks 15K steps every day. All right. And he takes 100 flight stairs every morning to his office during working days. So it's amazing, something even I can't achieve, on most of the days, but he's doing it. If he can do it, why not anybody else? And his heart function is roughly about 30 to 35% only. So in a normal range would be about 60 to 70%. So his heart function is about 30 to 35, and he's doing it. So that means we shouldn't tell we can't do, lifestyle changes when there are, evidences that people can do it.
So who needs elevators anymore? Okay. Now, how is heart failure diagnosed by doctors, and are there any specific tests required?
All right. So when we talk about how doctors diagnose heart failure, there are 2 ways to go about it. There are signs and symptoms. So signs are generally measured. So when these patients, they come in, first, most of them will come in with symptoms. They will complain with shortness of breath, even when they are doing their daily routine, even as they are, walking to the hall, or even as they are, climbing the stairs, 1 flight of stairs, they are already feeling breathless. Okay, so when these symptoms are limiting their daily activities, most of them will come into the emergency. And like I said, remember, when the water accumulates in the lake, okay, that is another symptom. Okay, and they feel dizzy, there's, the heart beats a bit too fast. So these are the first few symptoms where this patient comes in with. Next, the doctor will do, a series of blood tests. And there are specific blood tests that the doctor can do, like pro-BNP, for example. So when they do this, these markers, they will tell the doctor, okay, whether the patient has heart failure or not. So the symptoms and signs, when they actually show towards the heart failure diagnosis, then the doctor will inform the patient about it.
Now, if you just joined us, we're talking to Nirmala Jagan, pharmacist from Cardiology Center, Sultan Idris Shah Hospital, Serdang, talking about stronger heart, smarter care. Now, with that, before we let you go, Nirmala, do you have any advice to our listeners out there and also those online before we let you go?
Oh, thank you so much again and again for this opportunity. I think most importantly, dear listeners, all right, first and foremost, take your medication as intended. All right, if the doctor has prescribed it as 1 tablet 2 times a day, please take it. such a way. If you have any difficulty, tell them due to your work lifestyle. For some reason, if you are unable to comply, there are always alternative if there are. Okay. Second of all, this session, although it may end here, if you have any questions with regards to medication, okay, you can always contact National Pharmacy Call Center known as NPCC at 1-800-886722 from Monday to Friday, 8 a.m. to 5 p.m. except public holidays. And remember to follow Kenali Ubat Anda at Facebook, Instagram and TikTok for the latest announcement and information. All right. So I hope with that, we can use our medications to help us better.
So the numbers again is 1-800-886722.
You are right.
Open from 8 to 5 p.m. on Monday to Friday, excluding public holidays.
You are right.
And for further information on the latest when it comes to medications, you should log on to either their Facebook,
Yep.
on Kenali Ubat Anda.
Yes.
There we go. So thank you so much, Nirmala, for coming to the studio and enlightening us on the importance of heart failure and the symptoms and how you actually can treat it. So we're going to go for a short break, and then when we come back, we have the news at the top of the hour. And of course, thank you so much for those who are online on Facebook and also TikTok. Thank you for your love, likes, and also shares and question as well. For now, we're going to go for a short break, and we'll come back the news. So stick around right here on Traxx. Good morning, Malaysia.